Dear students, welcome back. In the previous session, we have discussed cost of dynamic stability, and now we are going to see the integrated function of the shoulder complex. In all the previous sessions, we have seen individual parts of the shoulder complex. So, what are the joints which includes the shoulder complex? So the joints which includes the formation of shoulder complex are, it consists of 3 anatomical joints and 2 functional joints. The important 3 anatomical joints are sternoclavicular joint, acromioclavicular joint, glenohumeral joint, and these are the 3 anatomical joints forming the shoulder complex, whereas the subacromial joint as well as the scapulothoracic joints or the functional joints all together called as shoulder complex, isn't it? Yes. In the previous sessions and all, we have seen all the functions of each and every joint separately. Now, in this session, we are going to see the integrated function of the shoulder complex. So, how much a joint is going to helpful in a single movement? That means how much percentage of one joint is involved in one movement. In that same movement only, what about the contributions of the other joint? We are going to see in this integrated function of the shoulder complex. Okay, the shoulder complex acts in a coordinated fashion to provide the smoothest and greatest range of motions which are possible in the upper limb. Okay, the motions available to the glenohumeral joint alone is not used for the full range of elevation. Only the glenohumeral joint motion is not enough to get the full range of elevation. So the remainder range of elevation is contributed by the scapulothoracic joint. Okay, through its sternoclavicular and acromioclavicular joints. Because the scapulothoracic joint is a closed kinematic chain with that of the sternoclavicular and acromioclavicular joints. Okay, so under normal conditions, each joint makes its contribution not only for a particular pattern but also coordinated movements. So it is each joint contribution not only used for the particular pattern of the movement and also the coordinated movement known as ScapuloHumeral rhythm. Okay, so under normal conditions we'll have a rhythm called as ScapuloHumeral rhythm. So in this ScapuloHumeral rhythm, it has some contributions with that of the glenohumeral thing. One is the scapulothoracic and glenohumeral contributions, and sternoclavicular and acromioclavicular contributions are there to understand the integrated function of the shoulder complex. So, the ScapuloHumeral rhythm indicates, or this rhythm explains the integrated function of the shoulder complex. This ScapuloHumeral rhythm includes scapulothoracic and the glenohumeral contributions And next contributions in this scapulohumeral rhythm is the acromioclavicular and the sternoclavicular contributions. All these four forms the scapulohumeral rhythm. In that, the first contributions now we are going to see is the scapulothoracic and the glenohumeral contributions. So how this scapulothoracic and the glenohumeral contributions causes a rhythm. Okay, in this, the scapulothoracic joint contributes both flexion. So the scapulothoracic joint contributes both in flexion as well as in the abduction. Simply we can call it as elevation of the humerus. How it is going to contribute? By upwardly rotating the scapula. By upwardly rotating the glenoid fossa. Mainly the glenoid fossa. It is rotating upward. The scapula is rotating upward to expose the glenoid fossa up to 60 degrees from the resting position. Up to 60 degrees from its resting position. Okay. So if for both the elevations, for that means in flexion as well as in the abduction, the scapulothoracic joint will have the 60 degrees of upward rotation taking place. Okay. Of course, here the humerus is not fixed and it moves independently on the glenoid fossa. This glenohumeral joint contributes 120 degrees of flexion and anywhere from 90 degrees to 120 degrees of abduction. This is only the contribution of glenohumeral joint. That means here in this joint itself, the glenohumeral joint will have 120 degrees of flexion. 120 degrees of flexion and from 90 to 120 degrees of abduction taking place depending on the individual structural variations. Okay, so how much the scapulothoracic joint contributes during elevation? From resting position to 60 degrees. The glenohumeral joint contributes individually. During flexion, it is about 120 degrees of flexion, and in abduction anywhere from 90 to 120 degrees. These are the individual joint contributions during elevation. Individual contributions of range of motions during elevation. Okay, now, but it is not happened individually. Here, in any movement during elevation, the combination of scapular as well as the glenohumeral movement results in the maximum range of elevation to 180 degrees. So that means individual contributions is 60 and 120 degrees. But if both the contributions are occurred during elevation, it leads to 180 degrees of maximum range of elevation occurs. If any one of these two joints are not working properly, then the range of elevation is going to decrease. Now what is the degree of what is the ratio of these two joints? That is called the scapulohumeral rhythm in the contributions of scapulothoracic and glenohumeral contributions. So here what is happening here? The scapula and the humerus move in the ratio of 1:2 ratio, or we can explain like that also. The glenohumeral and scapular movements move in the ratio of 2:1. That means opposite. So in your textbooks it may give it as 2:1. So 2:1 means glenohumeral to scapular, glenohumeral to scapular motions in the ratio of 2:1. Here in this pig, the scapula and humerus moves 1:2. Both are same. Okay. So when the arm is abducted to 180 degrees, the 60 degrees occurs by the rotation of the scapula upward to expose the glenoid cavity for further range of motions, and 120 degrees by the rotation of humerus at the shoulder joint takes place. This is called as ScapuloHumeral Rhythm. So what is the use of this ScapuloHumeral Rhythm? What it will do? What is the purpose of this ScapuloHumeral Rhythm? So the purpose of ScapuloHumeral Rhythm is threefolds. The distributing the motion between two joints permits a large range of motion with less compromise of stability than would occur if the same range occurred at one joint. So normally such kind of rhythm helps in increasing the large range of motions with less stability normally when compared to the other joints with such a kind of range of motions. Okay, in any other joint the stability is maintained this throughout the such kind of range of motions, but in the ScapuloHumeral Rhythm, so it only permits the large range of motions and less compromise of stability. Okay, and next important purpose is the ScapuloHumeral Rhythm maintains the glenoid fossa in an optimal position. So here you can see the ScapuloHumeral Rhythm maintains the glenoid fossa in an optimal position to receive the head of the humerus, and increases the joint congruence and while decreasing the shear forces. And next, another important purpose of this ScapuloHumeral Rhythm is it is permitting the muscles acting on the humerus to maintain a good length tension relationship, which minimizes or prevents active insufficiency of the glenohumeral muscles. Just for example, if you think that, so if the scapula is not rotating like this, only humerus is rotating, then what will happen? The muscle attachments on the humerus will go into active sufficient. So if this one, the scapulothoracic movements is increased like this from 0 to 60 degrees, and the length tension in the muscle is maintained, okay, and which permitting the range of motion and decreasing the active insufficiency of the glenohumeral muscles. These are the important purposes of the ScapuloHumeral Rhythm. So, what are the three purposes of the ScapuloHumeral Rhythm? The ScapuloHumeral Rhythm helps in increasing the distribution of the motion between the two joints, permitting a large range of motion with less compromise of stability. That is the first one. And the second one is the maintaining the glenoid fossa in the optimal position to receive the head of the humerus, increasing the joint congruence while decreasing the shear forces. And it also permitting the muscles acting on the humerus to maintain good length tension relationship, which minimizes or prevents the active insufficiency of the glenohumeral muscles. Okay. During the initial 60 degrees of flexion or the initial 30 degrees of abduction, here again during the initial 60 degrees of flexion or the initial 30 degrees of abduction. So flexion and this one is abduction. What is going to happen? Abduction of the humerus. There is an inconsistent amount and type of scapular motion takes place relative to glenohumeral motion. During this period, the scapula seeks a position of stability. So that is called as setting phase. So during this period, at the initial stages, the scapula seeks a position of stability in relation to the humerus. So when at 60 degrees of flexion, that initial 60 degrees of flexion and initial 30 degrees of abduction of the humerus. Okay, that phase is called as setting phase. In this early phase, motion occurs primarily at the glenohumeral joint. Although it is stressing the arm may increase the scapular contribution. So at the initial ranges, at the initial range of elevations, only the glenohumeral movements are taking place. Only the humerus is moving, the scapula is in resting position. So, and during the increasing the range of motion, it is the movement of the humerus stressing the scapula for the further contribution. Okay, and then at this stage the scapula increases its contribution. It starts its contribution approaching to 1:1 ratio with that of the glenohumeral movement when at the initial ranges of motion. After that, the range the glenohumeral joint again increases its contribution. So in the later stages, the glenohumeral joint is going to increases its contribution. Okay, so it may increase to two times. So some investigators like Poppen and Walker found that the glenohumeral to scapulothoracic ratio, glenohumeral to scapulothoracic ratio is to be 5:4 between 24 degrees and maximum elevation in the plane of scapula. So here the ratio is reversed. So that means some investigators mentioned that with the glenohumeral to scapula. So the ratio is 5:4 between 24 degrees and maximum elevation in the plane of the scapula. Okay. They note, however, that the absolute angles achieved at each joint, yield an overall ratio of 1:2 of scapula and humerus or 2:1 of glenohumeral motion with that of the scapulothoracic motion. That is an overall ratio of 2 degrees of glenohumeral motion for each 1 degree of scapulothoracic motion. You can see here. So 60 to 120, that is 1:2 2 ratio. For example, if the scapula is moved to 30 degrees, so 2 folds of that is how much? So 30, here 60. Again it moves, so it is moving 30 degrees. The glenohumeral movement will move 60 degrees. So that means 2-fold it increase. So it moves to 60 degrees and it is moving 120 degrees. Like that, the ratio is going to be increased. So if 1 degree of motion of scapulothoracic joint increases, 2 degrees of motion in the glenohumeral motions. Okay, this is called as scapulohumeral rhythm, and the contributions of the scapulothoracic and glenohumeral contributions in the scapulohumeral rhythm. In the next session, we are going to see the sternoclavicular and acromioclavicular contributions in the scapulohumeral rhythm. That is the integrated function of the shoulder complex. How this sternoclavicular and acromioclavicular contribution is taking place. That means because the scapulothoracic joint is not an individual joint, it forms a closed kinematic chain with that of the sternoclavicular and acromioclavicular contributions. So for every movement in the scapulothoracic joint, which also causes movements in the sternoclavicular and acromioclavicular joints, how these changes are occurring in the sternoclavicular and acromioclavicular joints in the scapulohumeral rhythm, that thing we are going to see in the next session. Thank you.